Good morning to all lecturers and my fellow friends. Today, I would like to have my presentations on the title of Establishing the Diagnostic Reference Levels of CT Procedures at the University Malaya Medical Center. Imagine a patient comes in with a tumor visible on the CT scan. The challenge isn't just seeing it, it's about knowing how much radiation to apply for effective treatment while sparing healthy tissues. Here comes out with a critical question. How much radiation is enough to treat this tumor without compromising the patient's safety? So, every beam of radiation must be a balance between destroying the tumor and protecting what's precious. To strike this balance, we start with something essential, the diagnostic reference level. So, imagine you are cooking a gourmet meal. You need the right amount of seasoning, not too much, not too little, to bring out the perfect flavor. In radiation imaging, DRLs are our recipe, ensuring just the right dose for the perfect pictures. But please bear in mind that DRLs are not limits, they are the guardrails. DRLs play an important role in protecting patients from unnecessary exposure and promote standardized and efficient imaging practices. While general diagnostic reference levels provide useful guidelines, they may not fully align with the unique needs of UMMC. What works globally might not fit locally. That's why UMMC's DRLs are tailored to reflect our specific practices. This benchmark might not account for UMMC unique patient demographics, imaging equipment, or clinical practices. General DRLs are designed for a broad audience, but UMMC isn't general. We are unique, our patients, our equipment, our practices. Using this one-size-fits-all benchmark can lead to over or underdosing, putting patients at risk. Our journey begins with the important task of establishing diagnostic reference level for the CT procedures at UMMC. By defining these levels, we ensure that our patients receive the right amount of radiation, just enough for accurate diagnosis but not too much to compromise their safety. Next, we will dive into a comparison between our local DRLs and national standards, helping us see how UMMC measures up. Are we ahead of the curve or is there room for improvement? This comparison will guide us in refining our practices and ensuring we are delivering the best care possible. Finally, we will explore the impact of different CT scan protocols on radiation doses. How do verifying protocols affect patient exposure? By understanding these nuances, we can fine-tune our imaging strategies to optimize safety while maintaining the highest diagnostic quality. First, we collected data from 30 different types of CT exams at UMMC. These cases represent real-world scenarios, ensuring our results are grounded in our clinical reality. This is the foundation of our study, like gathering all the ingredients before cooking. Next, we analyze the data, focusing on key metrics like the median and 75 percentile radiation doses. Think of these dose metrics as the safety limit, a checkpoint to ensure we are not overstepping boundaries. To validate our findings, we will meet our two secret agents, the CAD-FAM Phantom, which helps to evaluate image quality across various CT machines, and the CTDI, a radiation detective. Together, they help us uncover how protocols behave on the same machine and across different machines. First, we study on how specific protocols affected both image quality and radiation dose on the same machine. This allows us to fine-tune the balance for optimal performance. Next, we push the boundaries by testing the same protocols on different machines. This reveals how machine-specific quirks like calibration, design, or even age can change the game. Imagine this, you have the perfect recipe for a dish, but every oven you use bets it differently. The same ingredients, the same method, yet the results vary. That's the challenge we face with CT protocols across different machines. This methodology wasn't just about gathering data, it was about uncovering insights into how we can standardize protocols while accounting for machine-specific differences. By combining tools like the CAD-FAM Phantom and CTDI Phantom, we are ensuring that every scan, regardless of the machine, delivers high-quality image at the lowest possible radiation dose.